This 40-year-old woman flew in from Sweden, where she lives full-time, with one very clear concern. Am I about to lose my lower teeth? And honestly, she wasn't being dramatic. Her teeth were so loose that everyday life felt like a gamble. Eating, talking, even just going about your day, there was always this fear that sometime and something would give out at the worst possible moment. When I examined her, it was obvious. These teeth had lost their support. They couldn't hold bridges anymore, permanent bridge. It wasn't a question of if they would need to come out or when, but that wasn't the real challenge itself. The real issue was this: how do you treat a full mouth case like this when the patient lives in another country and still make sure she can take fixed teeth in this so constricted time frame? The first plan was the textbook ideal solution. Remove the teeth, place implants immediately, and have her leave within a few days with a fixed bridge. Clean, fast, efficient. But in reality, it didn't feel safe. Her bone quality simply didn't give me the confidence to push for immediate loading, as we say that. So we changed direction completely. Instead of forcing a high-risk approach, we built a plan that actually fit her situation. So during the 10 days she stayed in Athens, I stabilized everything with a strong temporary bridge on her existing mobile teeth, just so she could eat, speak, and function without stress. At the very same time, we placed 4 implants to start the healing process in a controlled, predictable way. Then she flew back to Sweden with something she hadn't had in a long time: stability. Not perfect teeth, but peace of mind. 1 year later, she came back for the second phase. We uncovered the implants, added 1 more for better support, removed the remaining teeth that had become too mobile, and built her final fixed bridge on 5 implants. And that's when everything changed. Not just clinically, but personally. You could see it immediately in the way she smiled, spoke, and especially the way she ate without hesitation. For the first time in years, she wasn't scanning every bite, thinking, is something going to move? It was just normal again. And cases like this always remind me of something simple. There's no one-size-fits-all protocol in dentistry. There is only the patient in front of you and the solution that actually works for their life.